When you're sick or just need a pick-me-up, a dog might do the trick. Our own Jill Rappaport, dog lover herself, got to see the incredible difference animal-assisted therapy can make for some very young patients. Good morning, Jill.
Hi, Meredith. Well, as you know, there is nothing like canine companionship, and I recently saw firsthand what some very special pooches brought to smiles and relief to some very special children in need.
Hello.
Hello.
Would you like to have a visit from a therapy dog? She'll settle right on your lap. Okay, Lily, cuddle up. There you go. Good job.
Barbara Babikian and her dog Lily visit Morgan Stanley Children's Hospital twice a month.
Very good. You're very gentle with her.
Gay Cropper and her Brussels Griffon have been doing rounds here for 2.5 years.
Can I bring her home?
I think since you gave him all those treats, he'd love to go home with you.
They are just 2 of 25 different teams that visit here, part of Westminster's therapy dog program, Angel on a Leash.
Would you like a picture of Lily?
They bring pictures of their dogs to color and collect, along with smiles and some comfort to children and their families. What a difference this visit can make to a child.
I think it just makes them feel more comfortable and more like home.
And makes you more comfortable too, right?
This is a big, scary place.
But to work in a setting this delicate, with patients this young, requires a special dog and special training.
How many of you are anticipating visiting children?
Here at the ASPCA in Manhattan, it's the last day of a 6-day course for these future therapy dog teams.
It is a very, very, very big responsibility to visit wherever we go, but especially with children.
The class teaches people how to read and protect their dogs.
This is for you to watch your dog. Visiting is all about knowing your dog, and that's today's focus.
And trains dogs to listen to their handlers and deal with distractions.
Good job.
The teams aren't cleared for work until they've passed an evaluation like this and receive the Delta Society seal of approval.
Every time you interact with people, you're doing good. If you can make them feel better when you are there, well, then that's a good thing, and that could be a little miracle.
Doctors at Morgan Stanley Children's Hospital understand the benefits of animal-assisted therapy.
Our job is to take care of children who are sick, but children don't stop being children just because they're sick.
They've learned that treating sick children takes more than medicine. Tell me about the benefits that you have physically witnessed that these animals are actually doing for these children.
I've seen that children are much less stressed when the dogs come in the room. As you can imagine, having medical professionals come in and poke and prod them and examine them is very difficult for them. So having the dogs feel safe to them, it helps them to forget all the other things that are happening.
You're so cute.
The dogs do everything from bedside visits to occupational and physical therapy. And although the overall effects of the dogs are more psychological than physical, Dr. Kelly says that the visits may help reduce the symptoms of stress.
Oh, good job.
We'll see a reduction in their heart rate, which is a very sensitive marker in children of stress. So it is interesting to see the differences sometimes when the dogs are in the room.
The program has some unexpected benefits too. Tell me about what it does for you.
When you have the opportunity to put a smile on a child's face that's not feeling good, or they're lonely, they miss their house, they miss their dog, it's the best feeling in the world.
It's a feeling that Sherilyn Fry knows as well. As the chaplain of the Ronald McDonald House in Manhattan and an Angel on a Leash volunteer herself, she sees firsthand the impact the animals can have.
Oh, hi, Sarah.
There's absolutely no question in my mind that the dogs are doing good work, and you can just see that by the smiles that light up on the children's faces. The parents, the staff, wherever they go, they are doing wonderful work. They're blessed, and I'm blessed to be able to be the person on the other end of the leash.
And David Fry is with Westminster, and he's brought his 2 Angel on a Leash therapy dogs, Ty, who's lying down there taking a little rest, and Belle. Good morning to you
Good morning.
as well.
Good morning.
Jill, you got to spend some time with these teams. What'd you take away from this?
Well, I was just amazed, Meredith, that these dogs are meeting these children for the first time, and they were able to climb up on the bed and literally cuddle up in their laps and fall asleep. The comfort level, and then the joy it brought to the children, seeing how happy the dogs were in their laps, and then looking at the parents' faces. And the parents
They're
really
also feeling comfortable.
Just so happy to see their children really feeling some joy in a very stressful situation.
Now, David, there are going to be people watching this now wondering, could my dog be a therapy dog? What's the first step you take?
Well, the first step is to evaluate your dog. Do they enjoy being around other people? Do they enjoy being in situations where it might be a little crowded and sometimes a little noisy? And if you enjoy that as well, it gives you an opportunity to volunteer and do something with the dog that you love in your community, do some good for people.
Can pretty much any breed of dog, including a Heinz 57, be a therapy dog?
Of course. Now, some breeds are just a little bit better at it inherently, but if they have the proper training and the proper attitude and temperament, they can be good at it too. So any breed, any mixed breed.
And when you're out there doing your thing with your dogs, what's going through your mind? What's the most important thing that you're thinking about?
I just stay out of their way. Literally, I'm just the guy on the other end of the leash. I'm the enabler that allows them to be there. We are able to expand this program everywhere. We're at in Portland at Providence Hospital. We're going into St. Jude's in Memphis. We're here in New York, of course, at Children's Hospital and the Ronald McDonald House. We're very proud of what's going on with these guys. But we're just getting the dogs in front of kids and patients and their families and their siblings and the staff as well.
So it's a growing program, obviously.
Absolutely, we're very proud of it.
And Jill, you have 4 dogs of your own. Any one of them? Jack, I think, would actually be a great therapy dog.
Jack would be great. They're all wonderful. They were all strays, and they're so lovely and sweet. But Sweet Pea ate my sofa last week, so they're not exactly very well behaved. I just don't feel they might be suited for this program, however sweet.
Just a little more training, and they'll be as good as Belle or Ty, David.
We'll get you to work on it, Jill. We'll let you know.
Come to my house, David.
We worry too much about what we teach our dogs. We need to worry more about what we learn from them, and this is a great program that shows
Good
that.
advice, David Fry, Jill Rappaport. Thanks to both of you. And up next, some other shaggy fellows who make a lot of people smile. We're going to catch up with tomorrow's musical guests, Bon Jovi. But first, this is Today on NBC. Good work, guys.